So if you guys take Tums or PPIs, which are things like Prilosec or Nexium for heartburn frequently, you're really causing damage system-wide.
Okay, so there's a lot to unpack here. First, right from the get-go, profound misinformation in her little title header thing, saying that the effects that she's about to list apply to Tums and heartburn meds in general. That's not true. Tums and H2 blockers like Pepcid do not have any of these long-term effects that she's about to describe, so that's really important to know. Next, it is true that proton pump inhibitors have been associated with a lot of these effects that she's listing. These include C. diff infections, pneumonia, kidney issues, bone health problems, B12 deficiency, but at the same time, there are two things you have to keep in mind about this. One, these are all associations, meaning we don't know for sure that PPIs cause these issues. We know that people on PPIs in some studies tend to have these issues in a slightly higher degree than people not on these medicines. Some of these associations are more questionable than others, like the pneumonia concern is very tenuous and has not been supported well, whereas the osteoporosis risk with long-term, meaning multiple years of use, is a bit more legitimate. The important thing to take away here is that these papers that were done showing these associations still demonstrated a very small increased risk in people taking these PPI medicines. And in addition, most of these things that you're at increased risk for can be monitored for. For example, when I have a patient on long-term PPI, I check their kidney function once a year. I make sure that they're up to date on their bone density scans. The real takeaway from this information is that you should only be on a PPI medicine if you have a condition that merits taking a PPI medicine. The problem is when these medicines first came out, anytime anyone had any belly pain, doctors would just put them on a PPI to see if it helps. And they might just stay on it forever and no one ever takes it off their med list. That should not be done because of these potential risks. But if you have documented heartburn, if you have documented GERD, if you have an ulcer, and on upper endoscopy there's no cancer, there's no large hiatal hernia, then a PPI will probably be a good solution for you. These small associated risks of PPIs are not great enough to justify not taking a PPI, assuming you have a documented indication to take one. Talk to your physician, preferably a gastroenterologist, to learn more.